Okay, awesome. Well, welcome everyone to our second Q&A with Dr. Eric Balcavage and Dr. Kelly Halderman, answering your questions about thyroid and talking about the upcoming book, The Thyroid Debacle, as well. So everyone joining us live, good to see you, and everyone watching the recording, hope you can see and hear us okay. Dr. Eric, do you want to jump in really quick and give a quick intro for folks that maybe aren't familiar with you, and tell them a little bit more about what you do, what you specialize in, and then Dr. Kelly, you can go next and we can talk a little bit about the book, and then we'll jump into all of your questions because we got some really great ones to go over today.
Awesome. So thank you, Kelsey. Everybody, a little golf clap for Kelsey. She does a fantastic job. There you go.
I'm the host sidekick. That's
got
all you need to know.
So yeah, my name is Dr. Eric Balcavage, and I am a functional medicine practitioner. Started out in chiropractic world and got transitioned into functional medicine as a way to help family members, and then wound up realizing how many of my clients had thyroid issues. Just my traditional chiropractic patients had thyroid issues, and then started doing functional medicine. I've been doing that for about 25, 27 years at this point, I think. And, I've had my own ups and downs with thyroiditis and Hashimoto's, and able to address that. And now my primary focus is helping, sick people get well. And while I think a lot of people come to me because I talk through this lens of thyroid physiology, but ultimately the goal is not really to manipulate thyroid physiology as much as it is to get to the root issues of what's causing somebody's thyroiditis, what's causing somebody to have a thyroid gland condition, what's causing somebody to not be able to convert T4 to T3 optimally. And if we can do that, we can get to the root cause issues. Then not only can we help them convert T4 to T3, whether it's medication or what their gland makes, but we can do it in a more natural way. They need less medications, and their overall physiology can heal and improve, and they can get healthy and they can get well.
Love it. Thanks. Dr. Kelly, do you want to talk a little bit about what you do and what you specialize in and how it relates to the thyroid?
Sure. So once upon a time, I trained in traditional family practice medicine. I practiced medicine up until the point that it personally failed me. The model, I had to go searching for another way to get myself out of a very serious disease, a couple of them, one of which is Hashimoto's thyroiditis. And so I left medicine and went and got a naturopathic medical degree. My clients right now, I help based on naturopathic principles, nutrition. So I don't practice medicine per se. And, I don't need to, because the things that I learned from brilliant practitioners such as Dr. Eric Balcavage, they really changed my life. It's root cause medicine. I'm so grateful to have learned under people like Dr. Eric. This book is phenomenal about learning the ins and outs, whether you're a practitioner or not. This is something brand new. I'm just happy to be a part of it. And also this information right here that we're going to talk about, it's not medical advice. It's more educational experience and information. So we're not having answers to any specific medical questions. Rather, we want you to understand our approach. We want you to understand from a structure function lens, how we look at problems and, our approach, but this doesn't replace your doctor-patient relationship, but we're still going to have a lot of fun.
Yes, absolutely. Love it. Awesome. Okay, well, for the Q&A today, it's really just to ask questions that you have and get them answered. So that's kind of our goal today, and really provide a lot of great education. So what you can do is you can type your question. There's like a Q&A box at the bottom of the Zoom panel. So you can go in there and type your question, and I can go through those. We will definitely answer the live ones as priority, because you guys are here, you're taking time out of your day to spend some time with us live. So if you have questions, definitely throw them in there. And then in between, we've got a lot of questions that people submitted beforehand that couldn't make it live. So I'll kind of sprinkle those in as well. And I just want to throw it out there that you guys know this already, but the Thyroid Debacle, the book, is coming out this summer. So we're super excited to bring that to you all. And you're on the list to get updates for when the book is actually going to be released, get some book bonuses, all that good stuff. So we'll keep you in the loop. And if you have any questions about the book, this is a great place to ask those as well, like what's in it, what's going to be covered, and who it's best for, all of those things. So feel free to ask those questions too. We love talking about it, and I've read it and I'm excited for it to get out to the world as well. It's a great book. So if you have questions, go ahead and throw them either in the chat or the Q&A box, whatever's easiest. And I'll go ahead and just start with one that got submitted early so I can get everyone's brains thinking. So this one is about TSA dropping close to zero after taking a thyroid glandular. So Aisha asked this one. She said, some people find their TSA drops close to zero after taking a thyroid glandular. Even after reverting back to levothyroxine, TSH remains incredibly low many months later, and the patient becomes increasingly symptomatic. What can be done to restore normal thyroid function, and how long can it take for TSH to come back into the normal range? So Dr. Eric or Dr. Kelly, do you want to take this one? It kind of sounds like she's working with patients and had a few patients experience this potentially.
Yeah. So I'll take this one. I've never seen that happen when with glandular, so I can't give much insight into what's happened there. I will tell you that it is not unusual to see patients taking too much thyroid hormone, and that will definitely tank their TSH. And it can be extremely problematic. I just had a client the other day seeing somebody who's a functional or kind of puts themselves out as a functional medicine practitioner, and the person is taking more T3 in a day than they actually would normally make for their body weight. And they still have chronic hypothyroid symptoms, and their TSH is less than 0.005, I think. Okay. And so I'm like, well, how do you feel? Well, I don't feel great. It doesn't seem like I don't feel great. If I'm not meticulous with my diet, my workouts and everything else, I gain weight just looking at food. So I don't know that it's helping me. I'm like, well, there's a significance and importance to your TSH that I don't think the practitioner realizes. And the thought process in allopathic medicine oftentimes is that it's okay to drive TSH into the unreadable range, because their thought process, I think, is that what's driving the thyroiditis or the damage to the thyroid gland is an immune condition. So anytime the thyroid gland is trying to make T4 and T3, it's utilizing an enzyme called TPO, thyroid peroxidase. And a lot of the patients who have thyroiditis have TPO antibodies. And it was thought for a long period of time that TPO antibodies were the primary thing that was causing the damage to the thyroid gland. And so the thought process was, if we provide so much thyroid hormone medication that TSH isn't measurable, then there's no TPO activity, therefore there's no antibody activity, therefore there's less damage to the thyroid gland. Now, the problem with that is a couple things. One is that TPO antibodies cause a very small amount of the damage to the thyroid gland. So we thought they were little Pac-Men eating away the thyroid gland, and the reality is they're not. They're more like they're really more like the firemen coming to help put out a fire, right? So you wouldn't yell at the firemen for starting the fire, right? They're there putting the fire out. So the antibodies are really there as more of a cleanup crew, it looks like, than anything else. And for those who say, well, I have thyroglobulin antibodies don't cause any damage to the thyroid gland based on the latest literature and research. So I think we can kind of pause on that whole worry that the antibodies are the problem, because it doesn't appear to be the problem. The problem seems to be the lymphocytes themselves and the thyroid cells themselves responding to danger. But when people drive TSH that low, why would they start to have increasing symptoms? Well, TSH has an impact on converting T4 to T3 in your peripheral cells. There are receptors on your cells for TSH. TSH can bind to a TGR5 receptor that increases the activation of T4 to T3 inside your cells. And remember that most of the T3 in the body is not made at the thyroid gland, it's not made at the liver, but it's made in all the peripheral cells. Any cell that has an enzyme, this deiodinase 2 enzyme is the primary promoters of T3 that you see in your bloodstream. It's because T4 is brought into cells, it's converted to T3, gets used in the cell, and then pushed back out into the bloodstream, goes to another cell, helps that one out, comes out, goes to another one, and in about 12 hours, it gets metabolized out of the body. So if you suppress TSH super low, whether it's with a glandular or a prescription medication, you're going to lose the T4 to T3 converting capacity, or to some degree. So you're going to have decreased T3 in the cells. That's going to can trigger low T3, more hypothyroid signs and symptoms. So I'm not a big fan of people trying to jack TSH too low. Matter of fact, I'm a proponent many times that especially if they're on therapy and their T3 is low, that we allow that, we reduce the dose and let that TSH start to creep up, because that helps convert T4 to T3. Physicians for a long period of time, I think, tried to use free T3 and reverse T3 because they were part of the panel, but they didn't know what was going on. The more T4 they gave, the lower the T3 got. So, and then the more T4 they gave, and a lot of clients, the higher the reverse T3 would go up. So there was this general consensus, like, you know what, let's not even look at those values. They're not important. We just change the metric. It's like what we do with the consumer price index. If we don't like what inflation's doing, let's just take out the measurables and change them to something that makes the numbers look better, right? So inflation right now is only 8%, right? Well, reality is, if we use the same CPI we used 20 years ago, the inflation's 17%. So, you know, it's all about measurables. So what doesn't get measured doesn't have to be managed, and now we only look at one value. So it would be my guess to answer that question is that there's probably a couple things happened, is that she took the medication that lowered the TSH because it's flooding the system with thyroid hormone. And then two, that initiated some increased inflammation, increased tissue danger signaling, and that increased inflammation then led to further suppression of TSH. And now the issue for that clinician or that person is, what did I do by adding that excess thyroid hormone? What problems were created with that? And we see that, and I'll let Kelly kind of finish that up, but I see that a lot with people just trying to flood more thyroid hormone into the system. They create problems that the patient didn't need to have by trying to just force more thyroid hormone into a physiology that doesn't want it.
I don't know if I can add anything worth adding on that, Eric. You nailed it. I mean, I completely agree. I see the same thing in practice. I was trained under the model that, you know, threw those values out, and because I didn't understand them. Now that I understand them and I understand the physiology, again, that's what you're going to learn in the book. You can hand this to your doctor as well. You're going to learn those. They're going to be right in front of you, so you can read it again. It's high level, but yet Dr. Eric and I, we make it digestible for you to understand. And it's all based on published literature that's irrefutable with even the highest level of endocrinologists. It's all in the literature.
Yeah, that was great. And funny enough, Dr. Eric, I think my TSH was really close to zero when I started working with you, so I can relate to this, and I still had symptoms. And it's actually been bringing my TSH a little bit higher that has helped in reducing my dose also. So yeah, I experienced a similar scenario.
Yeah, I don't, it's frustrating. Like, and you know, the person who I just talked to, you know, last night with the 0.005, right? 2 zeros or 3 zeros and a 5. I was like, as I'm reading her health history and I looked at the labs, I already in my mind knew what was going on. I didn't even know I didn't even have to know what medication she was on. I already knew it. As soon as I saw the labs, I'm like, all right. And just what's interesting is, she's taken Armor, she's taken all this T3 separately. When you look at her total T4 is under 4, right? Or right around 4, which is lab low, right? Free T4 is low. Free T3 and T3 are low, right? And so the question becomes, wait a minute, I'm taking T3. How can it be low, right? Shouldn't it be high if I'm flooding my system with it? Well, remember, the half-life of T3 is 12 hours. So normally, if you had appropriate amounts of T4 in the system, you've got plenty of backup reserve that can be converted. When you are suppressing thyroid gland production of T4 and you're relying on a little bit of T4 from your medication, you don't have this circulating supply. You can't make that T3 to keep it up. So you almost become a slave or a junkie to your daily T3 because you've really shut down all the possible ways that the body's going to make it on its own. So I see these people get stuck in a position where they can't even get, some of them really, really struggle to get off of their high dose T3 because they've shut down T4 production. They've suppressed the gland. The gland may even be starting to atrophy because it's not even being used. And they're on high dose T3 and they don't feel good. And they started a lower dose, go up, go up, go up, go up. And they're like, if I don't take it, I don't feel good. Right, because your TSH is so freaking low, you can't do it. And you're suppressing your thyroid gland, even if you still have a thyroid gland. And so it's a really nasty situation for people. So it almost, I know there's a few people that have done well, and people talk about doing high dose T3 only. I think if you're willing and committed to stay there, you can probably do okay. But I don't think it's what we need to do for the general population because we're not restoring normal, helping them restore normal physiology. We're just giving them a different drug to rely on.
Totally. It's a vicious cycle. Okay, so we got a few questions in the chat that we can cover next. Consuelo, let's go with yours, and then Jessica, and then the third question that we got. So I'm guessing Consuelo has been following you for a while because he understands root cause. So while fixing the root causes of your thyroid problem, how can you support your thyroid?
You want me to take that one?
Sure, go for it, and then I'll add on.
Okay, so, the key is, depending on the level of damage that's done to the thyroid gland, some people need thyroid hormone. I mean, just, you need it, okay? But to me, I would prefer that we give the person, I would prefer somebody take T4 when we're trying to work on the process. If you're not working on the process and you're not converting T4 to T3, a T4, T3 combination is probably a better thing because you're not converting it well, so you're going to need some. But if you're working on the process, then I would prefer to see a person just on T4 medication, but they need to be on some probably. If their gland is not making sufficient, how do we know that? We look at their levels. And the reason I say that is because I can use that thyroid panel and I can look at the ratios then and see how good a job they are doing converting T4 to T3. If they're taking T3, then my T3 to reverse T3 ratio doesn't work. If my free T3 to reverse T3 ratio doesn't work, my free T3 to free T4 ratio doesn't work because what the T3 that's there isn't necessarily what the body's converting, it's what they're taking, or what they're taking is mixed in with that. So I prefer to see T4 only if we're working on a process. And then I'll look at the rest of the labs to confirm, hey, are we doing better here? Are we seeing better conversion? And I do see that with a lot of clients. Now, that doesn't mean that there aren't some clients that I think do well on some level of T3, but I don't think it's the place to start. I think if you do as much as you can, and they're still struggling a little bit, and a little bit of T3 helps, especially if maybe they don't have a thyroid gland or they've had some liver damage. So there are some tissues that may be making it hard for them to fill the gap, or you've kind of reached a point where done what you can do for now, and they need a little bit more boost, then maybe that T3 component, it makes sense. But to me, when I'm working on the process, I want primarily that person to be on T4. And then what else can you do to help improve their thyroid physiology? And I think I should say all the time, I'm not talking about the thyroid gland. I'm always talking more about thyroid physiology, okay? Because some people don't have a gland, and everybody sometimes gets focused on the gland. The gland's a small portion. It's a big portion, but a smaller portion than I would tell you that the cell signaling is. The cell signaling is a bigger portion than the production, than the thyroid gland itself. And you might say, why is that? Because I can take out your thyroid, well, I can't, but somebody could take out your thyroid gland, they could radiate it, they could, it could be destroyed, and we can give you T4 and replace much of what your thyroid gland was doing. So, and you could feel great on medication with no thyroid gland, or you could feel lousy. And that all comes down to what's happening at the cell level. So while we're trying to, step one for me is to make sure the patient's got enough in the system, not too much, not too little, but enough for now to keep them stable. And then I want to get busy addressing the root issues. Is it their diet? Let's modify their diet. Is it their lifestyle? Let's hey, they're up all night, right? They've got emotional stress. They've got they got poor fitness, right? We talk about all these things, these fitness factors in the book, and we talk about those things versus protocols of supplements to take, because we think that those are the most important things, is to modify your lifestyle, your diet, your emotional stress, your lack of sleep, your disordered breathing. These are the things that created the dysfunction to begin with, oftentimes. So why not start addressing those things? And most of those things you can start addressing before you meet the functional medicine practitioner. But then there's things that we need to address. If you're doing all those things already, or we've started working on those things and you're still struggling, then what we want to do is then look at the systems that may really be challenged at this point. Is the gut become dysfunctional? Has the liver become dysfunctional? Has the inflammatory or immune system become disordered, right? And that we now need to come in there and help kind of restore normal function and physiology. It's good to do those other things, but if your house was on fire, you wouldn't start trying to rebuild your house until you've put the fire out. And sometimes we need to come in and put the fire out, because all these things that you're doing well, but they're just not working yet. So we got to find out what's driving this chronic stress response. Cal?
I would just add, balancing the autonomics, making sure we're looking at the health of the vagus nerve and things. And some of those things are inherent to a cell danger response. So really, shutting that off and pulling it. But it is multifactorial. It's not usually just one thing. So that's why we wrote part 3, is that you can personalize that. It's not, again, a cookie cutter protocol that, that just one size fits all. This is amendable to the things you have going on, because I know Dr. Eric and I totally agree that, not any one thyroid patient is the same. They say, when you've seen one thyroid patient, you've seen one thyroid patient, kind of like Alzheimer's. It's all completely different. And, that statement about, we're not talking about the gland, we're talking about the process of thyroid physiology. I think that's extremely important. That's one of the foundations of our book. We're talking about the process of the physiology, which happens from head to toe in your body. So I would just add that to your brilliant, what you just said.
Yeah, it's so important to look at all aspects, and sometimes it's easy to take we can step back in our own life and kind of see where things are, and other times we can't see the problems. We just had Kelly and I have a mutual peer or friend, Madeline Lowry, who does a technique called the MAP method, and I've gotten a couple of emails because a couple of my clients have started to see her, and we're working on one of my clients, and she, I knew the emotional stress was a huge part for her. I don't think she was willing to go there, not willing to admit it. She's a driven woman, right? Trying to do everything and be this driven woman. But I'm like, okay, there's another piece here, the stress piece of it, but I don't think she was willing to really kind of give in and work on that part, right? You know, I'm tougher than that, right? And it just so happens she listened to Madeline on my podcast that you and I did together, Kelly, and she's been working with Madeline, and just had her on her podcast and had a discussion with her. And that was really the thing that, you know, when we talk about your metabolic fit, your overall fitness, right? You've got to work on different aspects of fitness. And we worked on her dietary fitness. We worked on her sleep fitness and her respiratory fitness and all these other things, but the emotional fitness wasn't where it needed to be. And that was holding her back. And so when she got that part worked on, every other part started working better. So it's so important to not come to a functional medicine practitioner hoping they've got the magic supplement, but be open to the idea that I've got to work on different aspects of me, you know, and my diet, my lifestyle, my emotions, my thought processes. And when you really open those things up, start working on them, a lot of things like your chronic gut issues probably can get better without the protocol after supplement, you know, and supplements, right? I can't figure out why I keep doing these protocols and don't get better. Well, because there's probably another fitness factor that's not as working as well. And like for that client, it was the emotional piece. And until she was really ready to work on it, all the other systems were going to struggle because that cell danger response was not about to go away. She was still in danger mode.
Right. Right.
Yeah, that's a great answer. And I would say a third of your guys' book is devoted to going through those fitness factors and talking about different ways that you can address them. So the book is really great for that. It talks about sleep, breathing, diet, metabolic fitness, physical fitness, everything. So
I think that being said, Kelsey, is that that applies to the theme of this isn't just a thyroid book for someone who has thyroid disease. Case in point, people always ask me, Dr. Kelly, how did you kill the Lyme disease? How did you kill it all in your body all the time? How did you kill it? And I say, I didn't per se kill anything. What I did is I changed my body. I changed the inherent ability of my body to manage, you know, an infection that, yes, I did have Lyme, you know, I had the testing for it, but really what moved the needle for me was going through all those fitness factors and optimizing everything I possibly could in my body. And I also do MAP therapy. You know, I make sure that my limbic system and my emotional health, I make sure it's not something that's standing in the way of having the health that we all deserve.
love it. Okay, great answer. All right, so here's a question from Jessica. There's a little bit more details in the chat box if you guys need it, but in general, it sounds like her question is, what would you suggest to someone who has perchlorate toxicity and wants to help their body detox from it? And if that could be contributing to extreme exhaustion, thyroid symptoms, all of those types of things. So yeah, I guess detoxification tips for perchlorate and how it relates to the thyroid.
Well, I'll go first because
This is right in your wheelhouse.
This is
it's
your
my
wheelhouse.
Yeah. Yeah. One of my problems when I was diagnosed with Lyme and mold and that is that I was just, my detoxification pathways were just not working. I had my gallbladder removed when I was 20 years old for no good reason. So I go back to biophysiology. I go back to the function of bile in the body, making sure that process is running smoothly. There's lots of podcasts. You can type in my name and learn more about that. The Better Health Guy has a really good podcast about biophysiology, which I've coined the term phase 2.5 detoxification. Make sure your bowels are working, you know, make sure you're sweating, kidney support, all the inherent ways that we can detoxify. It's important to have those pathways open. I would say too, is that, making sure your toxic load that you're bringing into your body, so you can focus on getting it out, but like day in and day out, make sure you're not, using any potions or lotions or things that are adding to your load, right? So being careful with that and not bringing any more in, but, specifically for chemicals, what have you, I just think we really need to have a liver that's in tip-top shape, kidneys, again, sweating. There's lots of studies on infrared saunas and things to help with toxicity. So that would be, my first take on it. How about your?
Yeah, I think everybody wants to do like some special detoxification. Like, what's the look? And people do them. Like, the issue is that your body's detoxing every single day, right? It's not like it went on vacation. Like, you know what? We're going to detox next month. Your body's always detoxing. And so the issue is, how do you just support those detoxification pathways versus, do I need a special thing to detox? If you're going to try and do a specific detoxification pathways for specific types of heavy metals or different toxins that you believe are in the system, you got to be really careful based on what with some of those that really specialize in that, because if you start mobilizing a bunch of toxins that your body already can't handle and it has in storage, and you have leaky barriers like a leaky blood-brain barrier or any leaky barrier, you're mobilizing toxins and potentially putting them into tissues that it's going to potentially create more issue. There's a reason your body's probably locking those things away in your fat cells, because your body's not equipped to do the detox in the moment. So how do you unload it? Do you just blast it out of your tissues with some type of medication, or do you help support the natural detoxification pathways that you already have? Which is, hey, if I go exercise and I start burning some fat, I'm going to start melting down fat cells and releasing little bits of toxins at a time. And then I can sweat those things out. I'm going to pee those things out. I'm going to start pooping those things out. And yeah, if you want to do something to support it, make sure you have a healthier GI tract. As Kelly said, how can I help support detoxification? Hey, one of the things to do is don't keep bringing more toxins into the system, right? So that's step one. Step two is make sure that all phases of detoxification are working appropriately already. It's hard to know for certain, but if you're not having a normal like bowel movement every day, like you're not seeing like 2 bananas show up in the toilet every day, you probably don't have normal bowel movement, right? If you have gas and bloating and indigestion with meals, you probably don't have good phase 3 detoxification or phase 2.5, right? If you've got lousy skin, maybe you don't have great liver physiology, right? So somebody should be able to help you uncover that. But the best way to help in my opinion, to help your detoxification pathways isn't necessarily, putting coffee do a coffee enema, right? That you can do stuff that way. But to me, I'm concerned when somebody doesn't have good detoxification and then we just say, hey, we're just going to force this stuff out. I'm concerned because I think the body's pretty smart. It may have been locking that stuff away. And I don't think doing a super aggressive strategy to try and open things up is probably the best way for people who are already chronically sick, already have inflammation, already have oxidative stress. I think it needs to be a little slower, more natural process than a forced process. And everybody's got different opinions on that, but that's my take.
And eat fiber. Get your fiber.
Mm-hmm. I mean, there's lots of simple things you can do that you don't have to be some aggressive medicine type detox, right? Yeah. Drink water, drink minerals, do good stuff.
Gotcha. I also attached or linked the podcast with Dr. Kelly on detoxification in the chat. So definitely listen to that, Jessica, and I'm sure you'll get a lot more practical tips from that, but best of luck. Okay, here's another one. How do menopausal hormone changes impact thyroid functioning and methylation processes? So is that stage of life affecting it? And then I also have one that's similar to this question that I may tack in. Does the body need less thyroid hormone with age or after menopause? And is that affected by if she's taking HRT, hormone replacement therapy? So kind of a twofold question, but they're very similar.
Yeah, so there's a lot of questions there. Cal, you want to go first? What do you want to do?
This is so, you explained this so well. You go first. And
All right. So a couple things. First is, do we need more thyroid hormone as we age, right? So I think technically your body, if your thyroid gland is working appropriately, what we're going to see is that you probably don't need, there may be a lower demand based on your activity level and the things you're doing. But what we do see is that we tend to see that people have a higher TSH as they get older. Okay. And there's probably a couple of reasons for that, especially for females. As you get older, you've got a lot more kind of stuff that your body's kind of working against. We're not quite as healthy, robust, and recover quite as easily as we did when we were younger. And a higher TSH is going to help you convert more T4 to T3 to drive the metabolism. Okay. So I think the thing you want to keep in mind when you're looking at, as I'm getting older, is we shouldn't necessarily be trying to keep a TSH around 1. And when we're into our 50s and 60s, we probably want that TSH to be a little bit higher to help maintain a higher level T3. So I don't think we should be panicking. I know functional medicine, you hear people talk about the optimal range is 1 to 2, but it's an optimal range for a number maybe all by itself, but we don't and shouldn't be looking at one number by itself. We should be looking at all the rest of the values as well to determine, is a TSH at 1, it may be normal, but it may not be appropriate, right? We might want that TSH to be higher so that we get more T4 to T3 conversion. And why might that be important? Because the T3 helps drive mitochondrial function. So it helps drive our energy production. And for females, as they get older and go through the transition and their estrogen levels start to drop, estrogen plays a role in mitochondrial function. So some estrogen in the system is really important because it helps drive mitochondrial function. And when you get older and your estrogen levels drop, you lose some of that estrogen-driven mitochondrial function. So maybe one of the reasons why it's probably better to have a higher T3 as we get older. We need a little bit more T4 to T3 conversion to help support mitochondrial function. So that could be one aspect in it. Now, we don't want somebody to necessarily just blasting their physiology with estrogen, because too much estrogen can block iodine absorption by the thyroid gland. It can have a role in reducing the amount of free hormones available, and potential other consequences. So I think when we're thinking about almost every value that we look at, it's not necessarily everything has to be looked in context, right? So should I just give more because I'm older? No. What are your what's the story that your labs tell us, right? If your physiology is working optimally, then, and we look at your labs and T4 looks good and T3 looks good and free T4 and free T3, they're within a more optimal range, and reverse T3 is not overly high, and TSH is 3, fantastic. That's awesome, right? Let's not panic. If it's 5 even, let's not panic. If the numbers look appropriate and your signs and symptoms are good, let's not worry about one lab value, because there's a lot of things that can cause it to change. So I don't think that it's necessarily based that you need to take more if you're on medication because you're older. I think what we see with people who are on medication is many times as they get older, their doctors are putting them on more thyroid medication because their TSH levels are going up, and they're not looking at the rest of the values to see whether that means that's good because it's converting more T4 to T3, or their person is complaining because they still have the same issues that caused their thyroiditis, that caused their cellular hypothyroidism to begin with. They're getting older, the inflammatory component's getting worse, And so they're not converting T4 to T3 as much. So if somebody's saying, well, you're getting older, you're going to need more thyroid hormones so we can drive this value lower. And so they wind up on more medications, not because necessarily of age, but because they've had their chronic health condition for a longer period of time. So I think that probably plays a bigger role than anything else. Cal?
Great answer.
Awesome.
Did we get it all?
I think so.
Yeah.
Okay.
We've got quite a few more questions too, so we'll try to blow through these ones. Well, not blow through them, answer them as thoroughly as they need to be answered, but there are quite a few.
So you're telling me shorter answers there?
No.
No, not at all. Okay, let's see here. So I think Stephanie's was first. Okay, so she got a diagnosis of postpartum Hashimoto's about 8 years ago. She feels like she's done everything, diet, lifestyle, sleep, supplements, detox, etc. She said her naturopath just put her on desiccated thyroid hormone. She feels better, but her last ultrasound has shows a thyroid that is heterogeneous with many nodules. I don't know what that means, but I'm sure you do. She wants to know what she's missing. So obviously we can't give personal medical advice here. Dr. Eric and Dr. Kelly don't know your specific scenario, but maybe they can speak to a couple of the areas that you could look at that your naturopath potentially hasn't. Dr. Eric or Dr. Kelly, do you have anything to add?
Well, I will say the literature says that when you have those heterogeneous diffuse nodules, that's obviously significant for diffuse thyroid disease, so and then teasing out whether they're benign or malignant is also just something that's important medically. So that's definitely something I would see in the medical track for, like the allopathic track. But Eric, do you have anything just right off the bat there with?
Yeah, what I would say is that, even though you feel like you've done everything, and you may have done a lot, but I hear that a lot, and people say, hey, I've done everything. And then when I look at stuff and I look at their health history and I look at their timeline, there's a lot of things they didn't do. And sometimes you don't know what you don't know, so that's not saying that you're not trying to do everything that you're aware of, but maybe there's things that you're not aware of, and there's maybe things that your naturopath that is not aware of either, right? Everybody has the kind of their system that they kind of do, and it's one of the things Kelly has talked about, and I kind of stolen it from her, is that we should be talking about principles, not protocols, right? And so people get into that, hey, this is my gut protocol, this is my thyroid protocol, we're going to make your thyroid work better, and we're going to do it by, your T3, you're not converting, so we're going to give you T3. I would not argue that if you weren't converting T4 to T3 well, and somebody gave you a combination of T4 and T3, you're going to feel better, at least temporarily, okay? Because you're now getting something that you weren't doing a very good job making. But what I would argue is that if you take it and you feel good and everything's better, that's great. But if you still don't feel well, you might wind up in that trap where, okay, now I need a bit stronger T3, I need a bit stronger T3, because the body's going, whoa, this is good. And then, oh, you know what? I don't want all this stuff.
Mm-hmm.
But I would say probably the best thing to do is have another set of eyes look at your stuff and see if they can take a look at your health history, take a look at your health timeline, take a look at your signs and symptoms, take a look at your labs, and see if they see something different. Even in allopathic medicine, I think Kelly could talk to this better than me, but if you had a diagnosis, you might go to a couple different people to get different opinions, like, okay, what is it and what do I do about it, right? You wouldn't necessarily take one opinion, you'd get a couple opinions and say, okay, that's the thing that makes the most sense to me. So even in functional medicine, I think we need to do that sometimes, is, hey, I've done everything I think I can. That's a common thing I hear from a lot of patients when they're new to me, or when we do discovery calls, and I'm like, okay, and then we start looking, I'm like, did you do? No, we never did that. You never looked at it happened last night. one of their long-standing problems is GI problems, and nobody's ever looked at their GI tract. I mean, so wouldn't you think? But they were doing hormone replacement therapy, thyroid replacement therapy. You know, they're doing a bunch of drugs and supplements, but they didn't do a functional test of the GI tract. So they thought they were doing everything, but not doing well, but they weren't, right? Sometimes it's just another eye looks at it. And, you know, Kelly and I, you know, the same thing. I may look at something and think I think I've got it figured out, but I could show the same blood work to Kelly and she may go, oh, well, did you see this? Or, you know what, I've seen this pattern before, and this is what it was when I saw a pattern like this, right? So it's not as simple as one lab value is going to tell you an answer. I'm always looking for patterns on labs. And sometimes we see specific patterns on somebody and you go, and when you see that again, you go, I know what that is. I know what we need to do in that situation. But if I haven't seen a similar pattern like that, I may be like, oh, I didn't know that, right? Or I would have, it's something I wouldn't have addressed.
Right. I would just add to that, make sure you're checking your environment. A lot of things that can get missed are like if you have a chronic mold or your stove is leaking gas, like some of those really things that you wouldn't think or, you know, some people don't think of, like a chronic exposure. Again, I'm not saying that like if you have mold in your house, you're going to have mold issues. Like, you know, like humans and mold have been around forever together, but that can be, you know, something that you want to look into. And then I also encourage everyone, because it's simple, easy, cheap, to do the visual contrast test. The visual contrast test is vcstest.com. It's $13. It can tell you if you have an active biotoxin, and they have a questionnaire in there too. Now, it's a little bit of being your own detective. Okay. So not a lot of people are going to know, not a lot of practitioners are going to know what to do with that. But I would say, if you think that you have like an ongoing, you know, there's basically like you can have an ongoing like Epstein-Barr, Lyme, mold, or you can have an exposure and it takes you into a cell danger and you're kind of stuck, but the exposure is not there or not. So I do have an article that I'm publishing on my website, and it goes a little bit more into that, but it's another piece of data for you, because when you have an active biotoxin, your ability to see contrast changes.
Interesting. I did not know that. I just dropped a link to that test in the chat, Stephanie, if you want to take a look at that. And then maybe, you know, the emotional piece that you guys discussed earlier could be a hidden cause. You talk a lot about proper breathing in the book as well. So maybe some of those things that aren't as obvious could be contributing. So yeah, I hope that helps. Okay, question from Larissa. When do you recommend an iodine protocol for hypothyroid patients, if ever?
When do I recommend iodine?
Yes, yes.
I don't know that I've ever really recommended iodine. So there's two big camps here. Okay, one is the Brownstein camp that says everybody needs to be on iodine. The other one is, I guess, Dr. Christensen's camp that says everybody is overloaded in iodine. And I think it's probably somewhere in the middle, right? I think iodine is important. We know it's important for the thyroid gland. We know it's important for overall health and well-being. I know there's some literature that kind of talks about if you're, different chemicals and medications can block iodine absorption. And there's also some discussion that if there is an iodine deficiency, the body is going to kind of steal it from the other tissues potentially to help maximize what's going on with the thyroid gland. But it's just not a thing that I wind up overly trying to say, hey, you need to take excessive amounts of iodine. And early on, we did the iodine skin test, right? And then we found out that that's not super valid. We talked about you can do spot iodine tests. You can do, I think, the Hakala test, right? There's ZRT's got a test. But I just don't put that much time and effort into prescribing it often. If somebody's got TPO antibodies, I'm probably telling them, hey, definitely maybe have a lower level of iodine, but I don't put that much time and effort into it just because I haven't seen it really be the thing that necessarily pushes the needle from a positive perspective. I've definitely seen people who've done higher dose iodine and blow out their thyroid. And so that's always a little concerning for me. That's not a good look for somebody to come in to your office with their thyroid, you know, sticking out past their chin. Not a good look. But it's a controversial topic. I think one of the big issues is we don't really have we don't have a great test. Some people will say, hey, you know, the 24-hour iodine test could be good. Well, I don't know that there's, I mean, I've read a lot of papers on iodine, and I just have not seen anything super convincing regarding the testing that I'm confident one way or the other. So I think if you're eating healthy foods for the most part, you're not going out of your way to consume excessive amounts. If you're taking a multivitamin, I'm not concerned that there's a small amount in it, but I don't think we need to be taking mega dosing. And I'm less worried about people micro analyzing every piece of iodine in their diet as well. I don't think that's a great strategy either. So I guess I'm copping out on that one, that, hey, I think if they're getting a small amount into through their diet and maybe some supplementation, that's probably okay. But if they are taking a larger dose, we'll keep an eye on what's going on with their thyroid gland itself and maybe their TPO antibody levels. But I just don't put that much time into it, the primary issue being iodine. Kel, do you want to add anything, or are you good?
No, I think we had that question on the last webinar, and we're just on the same page.
Great. Okay. Hopefully that answers it, Larissa. We have one from Michelle here. She just got all her amalgams removed and is wondering if you have any suggestions as far as thyroid hormone support and or to clear heavy metals.
Well, I think we kind of talked about, if you have heavy metal issues, the best thing to do is support phase 1, phase 2, phase 3 detoxification in 2.5. And the best way to do that naturally is exercise, get quality sleep, breathe well, eat good food, fiber, drink plenty of water, poop every day, at least once, twice might be better, sauna, sweat. I think those are easy, simple strategies. But you know, if you're looking at a specific thing you're trying to pull out of the system, I think there's specific ways to test for it, and there's specific things that have a tendency to pull different things out that you want to be specific for, right? It's not like one product pulls everything out. So I think you do, without guidance of somebody who does this and is aware of like where your barriers are, just do the natural stuff. Eat well, sleep well, breathe well, exercise well, move well, and you're going to support your detoxification pathways.
Kelly, anything to add? Detox Queen? No, I think in that podcast, if you choose to listen to that, there's some strategies on, you know, really supporting bile, specifically like the bile flow, getting the adequate amount of phosphatidylcholine, which the government says that we are really lacking. And that'll make your bile sludgy and not able to move. So I think Eric covered all the big things, but I would just add there's some simple nutritional things you can do as well to help that bile flow.
Okay, awesome. I think we have time for one more. So let's see. This one's pretty specific. Basically, oh, go ahead.
Maybe a little bit too specific for.
Totally. I guess I mean, generally, if your TSH is high, I'm guessing 5.5 is high, but your T4 and your T3, everything else is optimal. Do you need to change anything?
Well, how do you feel?
Right.
Yeah, so I think we talked about that, right? So TSH is higher, 5.5. T4 looks good, T3 looks good, free T4, free T3, reverse T3 looks good. Do you feel like you have hypothyroid signs and symptoms? Yes. Okay, well then maybe it needs further investigation, right? Like why would it might be elevated? TSH could be elevated because there's an infection, right? It's because body's gonna be immune. There's a lot of, everybody thinks about the thyroid, like the pituitary gland making TSH, like that's where it comes from. And it is, most of it comes from there. But your immune cells make TSH, right? You get TSH from your epidermis, your skin cells make TSH, and they have receptors for TSH. Now, how much that impacts the HPTA axis, I don't know that we know, but it's believed that, hey, there's probably a connection there, and more tissues make TSH than just the thyroid gland. So that being said, we have to understand in a bigger context of what's going on. Did you just exercise yesterday? Maybe your TSH is up because you just exercised, right? Did you get a good night's sleep or a poor night's sleep? What are the other factors that come into play? And so this is why we are screaming in this book, you can't just look at a TSH, and you can't really just look at a thyroid panel and determine whether somebody's got appropriate thyroid physiology, because there are plenty of times when a TSH can be elevated and it's totally appropriate. There's nothing wrong with your physiology. There's nothing wrong with your thyroid gland. It's just a shift in what your body's trying to do. It's trying to increase conversion of T4 to T3. It's trying to increase some production, and we have to take everything else into context. So we, Kelly and I would talk about that in the book. We talk about it on podcasts. That's why it's important to get the person's health history, their health timeline, their signs and symptoms, and to look at the rest of their blood panel. Because if their TSH is higher and they're insulin resistant, yeah, then I'm concerned. If their TSH is higher and their cholesterol is elevated, yeah, and LDL is elevated, I'm concerned, right? If their TSH is elevated and they have gut issues, like I have gas and bloating and pressure, or I've got this chronic sinus infection, yeah, then I'm concerned. And not that I want to suppress the TSH, but then I'm going, hey, maybe that's elevated because there's some type of chronic infection going on.
Great. All right, that puts us right at time here. So that was an hour. Thank you all so much for your amazing questions. We didn't even get through all the ones that were submitted early because you guys had some really great ones live here. So thanks for attending the live Q&A with us. The next one is Friday, June 10th. So if you want to come again, we're doing another Q&A then. You'll get an email with a link to sign up. And yeah, thanks for joining. Stay tuned for book updates. Dr. Eric, Dr. Kelly, anything to add?
I would just say, yeah, thanks so much for coming and giving us the great questions. It's awesome. I wish we had hours and hours to answer the questions, because as everybody knows, I can talk quite a bit. But we try and get through these and give you as much data as we can without being like particular about your situation, because we just don't know your situation. But I think the overall theme here is, if you don't feel well, there's probably a reason for it, and there's not one solution for it. So your best bet is to do the low-hanging fruit things first, which diet, lifestyle stuff, which we talk about all the time in the book. And if you're doing that stuff, and especially for the period people say, hey, I'm doing everything. If you're doing all that stuff really well, then it's time to seek out somebody who does functional medicine, who thinks function from a functional medicine perspective, not an allopathic perspective, to help you uncover the root cause issues.
Amazing. All right. Happy Friday the 13th, everybody.
Oh,
We'll see you on the next one.
All right. Take care, everybody. Thank you.
Bye, all.